Hi, I'm Steve Shorr, President, CEO, and Chief Cook and Bottle Washer of Steve Shorr Insurance and HealthReformQuotes.com. Today, we're going to discuss how to buy and how to shop for dental insurance. Part of the reason I'm doing this video is dental insurance, is low cost. But then again, the most in benefits is $1,000 or $1,500 a year. So in some ways, I don't really want to sell it because on health insurance, it's unlimited benefits. It could be millions of dollars. Life insurance can be $100,000, $500,000, $1 million. Disability insurance covers your paycheck, but dental insurance doesn't cover a whole lot. And sometimes I just don't really want to get so involved, especially at open enrollment when you're working on people that, have big problems getting their coverage. I don't necessarily want to work on someone who's going to pay $1,000 a year. We'll get into some of the things of people that do have big problems with their dental insurance, which just reminds me maybe a health savings account would help. So I'll, put that too. So, anyways, let's get into it. And I put up a web page whenever it's needed, and then I'll show you how to ask questions on the site and, how to enroll. So let me make my picture a little smaller here. Yeah, I think that'll do. So anyways, on the YouTube video, I'll put all of these links so you can go to each page. And yeah, that's where I was. So anyways, we have a page here for individual dental and vision plans. This is our general page, and it just talks about dental and vision in general. We've got a poster here. Oh yeah, that's what I was going to say. In working with my laptop, with my extra screen and everything, I won't always be looking straight at you. I'm looking at the screen, but this way I have a bigger screen, so it's easier for both me and you to see it. But here's a flyer that Blue Shield put out on how important dental insurance is. We have YouTube videos, on dental insurance. Here's a sample of what's covered. Here's more YouTube videos. You can get quotes right from Delta Dental, and you just put in our agent number that will get credit. And then if you go here to Dental for Everyone, you can simply put in your zip code, put in a date of birth, like 01/01/1970, select an effective date, and you'll get quotes. And this isn't my website. I've just got an affiliate link. And so it's me because the picture's there. And this will show you every plan. And then you can view the details of the plan so you can compare and so forth and do your own spreadsheets. If you only want a certain carrier, you can put down that you just want Delta, Nationwide, or Renaissance. And that's all there. You can enroll online. If you have questions, email me. But if you just say, what's the best plan? Well, I have to look up all these words, and I'll show you where somebody had just complained about a plan that they said they're upset because they don't have deep cleaning. And that's known as periodontal scaling. And I went and looked at their brochure, and it says periodontal scaling. There's no cost on the plan that this guy has. And so we're going to have to look into maybe they don't think it's medically necessary, or maybe we need to make a complaint somewhere. But when you look at a lot of the brochures, you have to know what the dental terms are. So anyways, this is our general page on dental, and you can get quotes from all those companies. If you're already with, say, Blue Cross, then you might want to have your coverage with Blue Cross just so it's all in the same place. You know how they work. Here's the Blue Cross brochure. You just click on it and it'll come up, give you all the details. Over here at the right, you can make these things bigger or smaller, on how you want to look at it. And then I was saying, right here, annual maximum, 500, 1,000, 1,200, and you pay more for that, waiting period. So it's just a function of looking through all these. I haven't memorized them all. I have to look at this too. So that's why you don't see my phone number that prominently displayed on the website. You have to tell me what your question is, and then I'll look it up and I'll give you a real answer, not something that I made up. And I think that's what differentiates me from most other brokers. Here's our Blue Shield information. They've got a nice brochure here. I did visit Blue Shield pre-COVID. Here's a video of me when I was there, how I was learning everything. Oh, going back to that question. No, I did show you that question where the guy asked about deep cleaning, and we looked it up and it should be covered. I have an appointment with him today. We'll see what's going on. Okay, that's Blue Shield. Okay, if you're with Covered California, you can get one of their dental plans, and here's a matrix. And, it came out not that clear on my website, but if you click, you can go right to Covered California's website. You'll see it a little bit clearer. And then if you go into your Covered California account, you can shop all those plans and see what's there. We do have the information on our site, but we don't have it all in yet for 2021. I'm waiting for that to be released. And then you can appoint us as your Covered California broker. There's no extra charge for it. I wish Covered California would let everybody know that. We do get a lot of people asking about dental implants. They're very expensive, and maybe you should just check out a health savings account on your other coverage. Take a bronze, go to health savings account. So if you do health reform quotes.com, you can also use our search engine. I just didn't want to use one of the tabs I already had open. HSA. So this will tell you the advantages of taking a bronze plan, save money on your premium, and then not only can you pay medical expenses, but you can pay dental, vision, eyeglasses, whatever the IRS allows. So anyways, we do have some plans that will cover implants. They're rather limited, so you'll have to check and get the quotes there. But they may cover it, but in year one they only pay 15% of it, year two 30%, year three 50%. So if you were told last week that you need implants, the time to buy insurance is when you can prove that you don't need it. Here's co-pays, videos, and then down at the bottom, you look through the other Q&A, but at the bottom you can look and see what questions have been asked, and then you can ask more questions. Oh, which also reminds me, if you're Medi-Cal eligible, we don't get paid to help you with Dentacal, but we would like to think that we have the premier website on Medi-Cal and Dentacal. Because here's with the entire beneficiary handbook. We even have the handbook for dentists. Here's, briefly what they cover, and we do have Q&A. So don't call me and ask about Denti-Cal. I don't have it at the top of my head, and I don't get paid to help you with it, but it's here as a public service. So if you make like less than $17,000 a year, you'll qualify for Medi-Cal, and then Denti-Cal is thrown in with that. For the exact details, you can check the information on the site or put a question in there. Anyways, this is, our Dental for Everyone, where you can get quotes from all these companies, enroll online. Now, it's possible that maybe my other client that says he's not getting paid on deep cleanings, maybe it's not medically necessary. Maybe it's not that detailed. So I'm not a dentist. I'm not a doctor. Send me all the paperwork. We'll see what we can do. We can always send it to medical review. The Department of Insurance brags that they get like 70% of the stuff done. Now, if I haven't impressed you already with my website, here's my background and experience. You can go to my biography page. I have a degree from San Diego State in insurance. I'm chartered property and casualty underwriter, and I got other stuff. I haven't done that much continuing ed lately or gotten any degrees because I feel I'm getting plenty of experience answering questions on the website, putting up, keeping up with what's going on, and so forth. But I am doing my mandated, 30 hours every 2 years for the state of California to keep my license. Now, where I do think dental insurance makes sense is if your boss is paying for it or you're paying for it for your employees, because then that $1,500 a year is at least tax deductible. You pay the premium. It's tax deduction for the employer. It's not taxed as income to the employee. And there, I think it makes more sense. Rather than spending, $50 a month on PPO coverage, I think you're better off buying life insurance, because then you've got coverage if something serious happens and keep your family from going to the poorhouse. And there's that. So I think that covers it for now. If you have any questions, just email us, steve@steveshorr.com. Thank you very much.